Okay, that's a funny one, a very interesting one, Sha. Um, Ideally, you shouldn't feel anything. I think based on our training, you shouldn't even feel anything at all. I usually don't feel anything. I'm speaking for myself, and I think a lot of guys will also agree with me because these people are sick. You don't just examine the privates like that. You must suspect that there's something wrong with the privates, worth examination, and then you examine like maybe a woman is in labor, a woman is having some form of genital tract infection or whatsoever, or a man is having anything with his privates too that you need to examine also. So you don't just examine the privates like that. Someone won't come with a headache and then you tell him to pull off or tell her to pull off her clothes. No, that doesn't happen. Or a woman has a problem with her breast and then you want to check, or the person might have something that may be related with the breast too. So that one happens. Those things are peculiar to us. So don't feel anything. All through the course of medical training, there's a way your mindset just clicks in that direction. Then another thing that helps, even if you tend to be attracted to a patient, which is wrong, you're not supposed to have any patient-doctor relationship at all. So far as that person is your patient, you cannot have any form of erotic relationship with the patient. So there should be a chaperone present. Usually, chaperone is also someone working in the hospital to help watch things. So when you examine a patient, because of privacy, you might want to do it in a closed area, and then the chaperone will be there. So there will be at least three people: you, the patient, and the chaperone itself or herself, depending on who. And the chaperone watches things because there are cases of sexual harassment flying everywhere, and the chaperone helps protect the patient from you in case, even if Konji they worry you like Konji don't enter, you stay, you cannot do anything with the chaperone there. And the chaperone also protects you from the patient because there are some patients that can be very mischievous. They'd like to take it, they might come that they have something wrong with their private parts and they just want that. There are cases like that. So the chaperone also helps. You get. So I have examined private, like I had been no and G for years. So it's a normal thing, like it's a very normal thing for us. It's a mindset, something like that. So you shouldn't feel anything. You shouldn't. But always examine with a chaperone. That's my advice.